Hi, I'm Dr. Tiffany Libby, and I'm a board-certified dermatologist and a mom of 3. As alarming as it may look, baby acne is quite common and affects 20% of newborns. It typically appears on a newborn's face, usually on the cheeks, forehead, and nose, and appears around 2 to 4 weeks after birth. And it appears as small white or red bumps. The good news is baby acne is nothing to worry about and usually goes away on its own in a few weeks or months. Baby acne occurs as a result of hormones, mostly those passed from mom to baby, that result in the enlargement of oil or sebaceous glands and an increased production of sebum or oil that leads to acne. No, as tempting as it may be, do not pop them and don't squeeze or pick at it, as it can potentially lead to infection and scarring. Wash baby's face with a mild cleanser that's specifically made for newborn skin. Research shows that baby skin is still developing and therefore more fragile than adult skin, so we want to make sure to use a product with their fragility in mind. For quick cleanups, you can also use micellar water like Mustela's no-rinse cleanser. The tiny cleansing molecules help dissolve dirt and impurities without drying out baby's face. Gently pat the towel against the skin instead of rubbing to avoid irritating the skin. Avoid greasy and heavy ointments. Instead, opt for a lightweight moisturizer. Even skin with acne needs to be hydrated every day. The timeline is usually a big clue, as neonatal and baby acne tend to appear within the first few weeks of life up until 6 months, whereas eczema tends to appear after 6 months into toddler years. They also look different, as neonatal and baby acne appear as tiny whiteheads and pink bumps, whereas eczema often presents as rough pink-red itchy rashes.